This presentation was created by Nancy Joyner, a palliative care clinical nurse specialist. This presentation is about what matters most, one of the 4 M's from the age-friendly perspective on health systems, taking care of our elders. Nancy Joyner is representing both the Center for World Health for UNT and Honoring Choices in North Dakota. The objectives for this presentation are how to align medical care with the people that we take care of, from their perspective, as far as outcome goals and wishes. Some of the tools that can be used to screen for each person that we take care of, because it has to be individualized. Then we'll talk about and summarize some of the action steps that you need to do to implement into your own practice on how to include what matters most. We know that for what matters, mostly for older adults, it's very much their independence, their sense of control, and not being a burden. Those are the things that really matter. We need to touch base on that. What are their values? What are their goals? What are our wishes with wherever they are, with their perspective, from a health system's perspective? It really takes into the effect of making sure that people are being heard, that the utilization is being appropriately managed, and that we're not having it used when people do not want it. There are some non-beneficial and other treatments that are being done. Almost 30% of what we do is unnecessary, not wanted, not beneficial, but for everyone. Let's get on the same page. We need to have that sense of community that we do understand one another, and we're talking the same language. We have our healthcare language, and we need to get down to what really matters to people. Serious illness can occur at all ages, and we know that it really impacts our older adults. We need to take care of them and be prepared to do the things that they need. The clinical picture, as we know, can worsen quite quickly, and they're not prepared for that, especially if they have underlying comorbidities and other conditions. At times, the connectedness that they need, the whole sense of community, is not there. We also are missing out on things like glasses and hearing aids. Do they have their cell phone and charger? Do they have connection methods for communication that needs to be there? Often, the frontline providers are not getting the information they need because a person is not able to share that because it's come in so quickly, and to be able to reach out to the other family and who's involved with that. What are patient priorities? They're not always the same for us. We might have our own agenda, but it's important for us to really look at that, to really understand what it is and values. What does it really mean to have values? What are their specific goals? What are their abilities and activities that they're able to do? Are they living well? Are there limits or trade-offs that we have to be looking at? What things are unacceptable fears and worries that may come up from their experiences? What serious illnesses they have had in the past or with other people? Also, sources of strength, such as spirituality, family, community, and so forth. It's important that we listen to their emotions, their values, and put that in perspective when we're designing our care plan, not specifically just for the disease. The other thing is outcome goals. When we think of outcome goals, we think of specifically from a disease perspective. As human beings with many perspectives, we have to put that together with the sense of who they are in the world. When we talk about preferences, we use the word care preferences, but everybody should provide care. It's important to focus on treatment and physical goals. If you don't ask, you won't know. It becomes the elephant in the room. We often forget who's going to start the conversations and how do we start the conversations. Is it comfortable? Are we allowing in enough time? Are we doing more of the talking? Are we allowing the person to do the talking? The social determinants of health are things that we need to be thinking about. Do they have enough food? Are they having enough communication? Are they having the community that they want? Are they still working? Are they having other environmental things that are going on? Cultural, ethnicity, gender, where they live, and so forth. Who is their sense of community? Their spiritual components. All of that goes along with it. The ultimate goal is that sense of belonging and the interconnectedness that we often miss in the healthcare world because we're so specifically designed for treating a disease. When we elicit values, we want to find out what matters most, whether it's connecting with others, enjoying life, what a good day looks like for them, maintaining health, and functioning the best so that they can focus on really what matters. Again, what matters to us may not be the same as what matters to somebody else. When we offer treatment, is it helpful? Is it bothersome? Are they doing the things that you are expecting? It may be a journey. The whole trajectory on people getting better or getting worse over a period of time. Or is it care that they really didn't want in the first place? Do they have the opportunity to say yes or no for medications and treatments, but how far and how much they wanted to go? When we want to go forward, then clarify those outcome goals. What are those things that we'd be willing to do and able to do if you had more energy? If we really were going to be able to get back to that, then target one specific goal. Sometimes people think health is a good goal to be with family, or sometimes it's to allow natural death. They're all different kinds of components of where somebody is in any given time. We have conversation starters to help. This came from Patient Priorities Care. Who are the important people in your life? What about your health? Are you hoping your healthcare can do more for you? What's important from that perspective? What kind of actions do you want to take? What are your activities? What about dignity and self-sufficiency? All these different components fit together. Do we allow enough time to really process this and hear what somebody has to say? There's also the Go Wish game. There's an online version that you can use. It's designed for teens and older. You have a deck of 6 cards, including a wild card for something that might be important, but it goes through things like what matters most, as far as free of pain, being hooked to machines, time with my family, trusting my doctor, and so forth. You prioritize them. You take the top and put that in your top pile, and then the others in the other pile. After you've chosen those 10, you talk about them with one another. This is the Serious Illness Conversation Guide. It's from Ariadne Labs. For those of you that might be familiar with Atul Gawande, he goes through the guide first to set up things. Think in advance. Find out, is this okay for them? What is their understanding of now? Where are they with their illness? How much information? Some people want just a little bit. Remember how we get there, giving that prognosis, tailored for that information, if that's within the perspective of the whole team being on the same page. For the goals, if your health situation worsens, what are your most important goals? What matters most? Are there fears and worries? What is the biggest fear and worry they have about their future? The function? What are their abilities that are so critical to their life that they can't imagine living without them? Are there trade-offs? As you become sicker, how much are you willing to go through the possibility of gaining more time? From a family perspective, how much does your family know about your priorities and wishes? Talk about how much do you want them to know. You're going to be asked, acting on affirming that commitment to maintain some recommendations, and make some to the patient that they may or may not agree with. Give them a timeout for this. Opt out of the things that you don't have to do. These things are options for you. Make sure to document your conversation and get it to everybody else that needs to be on from the team. Provide the person with the family communication guide. Vital Talk is another great tool. It makes communication skills for serious illness learnable. This is scripting type things with how to do that. On your phone now, you can have it downloaded. It's an app called Vital Talk Tips, and it goes through each different section. Whatever different information that you want, from advanced directives, some of the online things, what if a person is getting close to nearing the end of life, and so forth. There's lots of good information there for you. Are people able to do their basic ADLs? Are they able to do it from a perspective? Do they need some assistance with it? Most individuals want to maintain independence or regain it as quickly as possible and not to be a burden or not to have too much reliance on somebody else. Think of yourself. How would you feel about somebody taking you to the bathroom and helping you wipe your backside, or a granddaughter or something of that nature? Boundaries and self-reliance are such important things. Did we add the instrumental ADLs with groceries, being able to pay bills, go shopping, cooking, and just maintaining your daily life within your home, managing your own medications? Are you able to do all of that? Are these things that do matter to somebody? Some of these things are either back burner or at the top of the list, and what we can do for it. Through the Canadian Occupational Therapy, they have what's called a What Matters screen. These are all the different questions. How important is it to you to do these different things? These are available for you in the resources to help you to ask questions. We often recommend utilizing other people if you need to. When we get to this, they say, based on these activities, how would you rate yourself? It is important to me. Important, but I need some help with it. Not important, but I'm able to do it on my own, or could use some assistance. It really gives some perspective on where a person is at any given time. And of course, baseline changes over a period of time. There are some tips on how to act on it. Once you do have this, use this as a care guide for decisions. It guides you to what you're going to be doing. It's going to aid in that communication that's there, because this is going to be shared decision making. It needs to be dialogue going back and forth, clarifying goals, and making sure that people do not feel lost or confused along the way. Assess if this really is beneficial or not. What may be beneficial to us may not be beneficial to somebody else, and vice versa. It's important to have those things out in the open and discuss it openly with them. We want to be able to collaborate in negotiations when they differ. For instance, I can offer you a CPAP. I know you don't like it, but can we give it some time? Do a time-limited trial to see if it does show some improvement or makes you feel any better. Many people are really reluctant to try new things, and so time limit trials are always great with a goal at the end. Make sure to include your interdisciplinary team, social workers and nurses, nurse practitioners, the chaplains, therapists, and psychologists. With that, we have that communication. We all have pieces of the puzzle that we can put together because humans are more than just a physical body with a disease. It's not just a person with cancer. It's not the cancer patient or the dialysis patient. It's the person experiencing that disease. The biggest thing is pulling palliative care. Almost every hospital now has some dimension of palliative care. If you're not familiar with it, check it out, because they offer so many different things that are there. Most important is the ability to have time for more communication, time for addressing symptoms and issues. It needs time to really explore what matters because there's so many broken pieces. We have this time frame by pulling them in as yet another team member. It's just an amazing thing, so please don't forget palliative care. When we're looking at some of the decisions, use those patient priorities. It's the focus of communication to make healthcare decisions. We have our list of different orders that we can do, different medications and different testing, and so forth. Use that to filter back what it is. We really want to do trials, little bits here and there. If there's any kind of complex or uncertainty of something going on, because a time-limited trial will say, yes, it will not work, or no, it won't. Align the care and decisions among the patients and clinicians that you're taking care of. It's going to be guided by their priorities. Make sure that those decisions, that we're all on the same page, that we will really have that strategy to go through with that. The essential ingredient is to ask what matters. Who? What? When? What kind of questions? Open-ended questions. They should be talking. The people who we are taking care of should be talking a lot more than we are. And then document what matters, what those different things are. This goes back to that patient priorities care that I showed you earlier. You're going to align with the plan of what it is. How do we know if that has happened? Have we tried that in the past? What has worked in the past? Can we align it with things that we can do moving forward? We have the past and the present to work with, but we need to look for the future as well. That leads us to what is advanced care planning. Many people think immediately of the advanced directive, which is much more than that. It's the process and communication that needs to occur. The definition is truly a process that supports adults at any age or stage of health and understanding, and sharing their personal values, life goals, and preferences regarding current or future medical care. The goal of advanced care planning is to help ensure that people receive medical care that is consistent with their values, goals, and preferences during serious illness and chronic illness. We often miss that one part of it. This leads us to, what is advanced care planning? What is the future? It's more than just that piece of paper in the advanced directive. The definition is a process that supports adults at any age or stage of health in understanding and sharing their personal values. It's a communication part, what their life goals and preferences are regarding current or future medical care, with the goal of ensuring that people receive medical care that is consistent with their values, goals, and preferences during serious and chronic illness. If we don't ask, we won't know. We need to include that, and we don't always incorporate that into what we're doing. Advanced care planning is a whole-person approach. Sometimes it's going to be other pieces of this pie that are going to be. They're not always exactly the same size that are more pertinent in coming forward. It's not always just the physical part, but it's important to be looking at it from a full perspective. It's across the whole lifespan, the whole continuum, from the time when we're healthy and independent, to when we're developing more chronic disease or advanced illness, to the point of near the end of life and allowing natural death. The goal is always to maintain, maximize health and independence wherever it is.